One of Africa's most populous cities and fastest growing economy is also Nigeria's commercial hub. This city prides itself as the center of excellence and has remained an exemplar of socio-economic development on the continent. I'm Adedoja Salam Adeniyi, and you're watching Inside Lagos. Welcome back. Governor Babajide Sanwo-Olu has allayed the fears of residents over the first confirmed case of coronavirus in the state. Mr. Governor called for calm during a press briefing at the Marina State House last Friday, saying the federal government and the Lagos State government are already working closely to prevent it from spreading. The governor's briefing became necessary to put out key information and prevent the spread of rumor and fake news after the index case of coronavirus was recorded in the state.
We have triggered all our various levels of biosecurity and containment. Like he did mention, we're up till early hours of this morning contacting both the federal authority, including Mr. President, and everybody that needs to be aware, including the facility that this patient had contact with, the chairman of the company and everybody in the company. They've been very supportive. They had proactively also curtailed their own staff. So like the commissioner said, we have gone out, people are out there now trying to track every of suspected interaction that this patient might have had contact with, and we're ready. Our facility has been fortified to continue, if need be, of any form of test and containment if need be. And we want to assure our citizens that for us here in Lagos, everything that needs to be done, we're doing, and we'll continue to have dialogue, and support, if required, from the Federal Ministry of Health. But we're assured that, like the professionals have said, that this patient is stable, and every health intervention that is required is currently being given, and we can say that we're ready, and we're just hoping that we can very quickly put this behind us.
He was brought to our high containment facility in Yaba on Thursday morning. Immediately he arrived, he was put into strict isolation, and the appropriate tests were ordered. Within hours, we received the signal that the test in the laboratory was showing signs of positivity. At that point, we informed the Federal Minister of Health. I informed the Incident Commander, our Governor, Mr. Babajide Sanwo-Olu, and the Honorable Minister informed the higher authorities in Abuja. We're in constant contact with the Nigerian Center for Disease Control and the Minister of Health in Abuja, and we're exchanging information continuously. The important thing to know now is that the patient is confined. We have aggressively started to identify all his contacts all the way to the airline.
As part of efforts to enhance its communication with the public, some helplines have also been made available by the state government as a reporting and feedback mechanism. 0803 35 65529, 0805 281 7243, 0802 3169 485.
The Yaba Mainland Hospital is where the index case is being attended to.
The first case of COVID-19 patient in Lagos, Nigeria has been said to be clinically stable with no serious symptoms and is being managed at the infectious disease hospital here in Yaba.
His vital sign is stable, is conscious. We discussed this morning and we took some sample from him again for some investigations. So we have no cause to worry. He's the only patient and we're hoping that there won't be more than one. Because everybody he come in contact with have been traced by the State Ministry of Health. Nobody is sure. Nobody can say definitely how what the transmissions are. But we know, or what we know so far is that it could be transmitted by aerosol. That means that it is airborne. And then you could also get it by touching any person that is infected. So when we go in to see patients, we actually put on some special materials so that we don't get it either by airborne or by touch. So panic should not be there. Then of course, don't get your information from the wrong source. A lot of wrong information are going to be on the social media. So ensure that you get your information from the right source. Then maintain proper personal hygiene. Hand washing is one of it. Cough etiquette is also, cough hygiene is also one of it.
Nigeria has now joined more than 50 countries scrambling to contain the outbreak of the novel coronavirus, with scores of persons already under surveillance from Turkey, where the index case boarded a Turkish Airlines flight to Lagos, and Ogun State, where he went for a business meeting.
It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the virology laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control.
Yaba is our infectious diseases center. So the essence is we isolated it from the normal general hospitals. So the Biosecurity Center in Lagos has 100-bed dedicated to this virus in case it happens. So the gentleman that's now diagnosed to have the virus is in that hospital and is getting treatment. So this is what happens. So you have a diagnostic equipment that allows us to detect this early. Remember, he came into Lagos yesterday morning, and by afternoon all the tests has been done. Then we certify that okay, it is actually positive. So it's been isolated, it's been treated. So what that means is we have the PEP suits, we have the mask for all the. So the essence is we were ready before now. We have all the equipment to do the test and everything, so that if anybody develops it, the biggest challenge for us is not to be able to get hands on people that probably have it. So we are lucky in this case. The gentleman came in through the airport. He was taken to somewhere in Ogun State, and then when they call us, we actually brought him back to Lagos in that center. You know, on the airline, everybody fills a form. So what we are now doing is to go back to those forms. Hopefully the information are correct, so we are contacting everybody, and then even the driver that took him from the airport to where he went, and in that company. So those in the company, we've been able to identify them. We have identified the driver, so they will be tested, quarantined. So the airline, we are going on that now. Hopefully we'll be able to get everybody to check them. Hopefully a lot of them have not gone to other country or whatever. So, but the reality is that we are tracking all those people now, so that at least we can check their status to make sure that this thing has not spread to any other person. The moment people are identified to have it, and they bring them into the isolation center, they can be treated and they'll be fine. So what is important is the readiness of that infrastructure. Lagos is ready. We have everything that it takes. We have the facility in place. We have the PEP suits. We have the mask. We have the doctors in place. So as long as we are able to track people and bring them in, there should be no panic. A week or so ago, you will notice that the Minister for Health was in Lagos. He went to that Biosecurity Center to check that is he aligned with the protocols of federal government. So, and in fairness, he said, oh, we are clearly the most ready. In terms of coordination, we are working with the federal government, or the Center for Disease Control, and Lagos State government. As a matter of fact, If you go to the airport today, 24 of those staff checking people at the airport are Lagos State officials. So in partnership with the Federal Ministry of Health. So we are working together because this is to protect our state and is to protect our country. Over the next few days, people will see that they will give everybody status updates without mentioning the gentleman's name. That it's okay. If we've detected another person in the process, we will announce it. So what is important for us is to be transparent, tell people the real situation, and then give guidelines as to what people need to do. And it's what our parents have been telling us since. When you want to cough, cover your mouth, or sneeze into your elbow, or go around with handkerchiefs, clean your hand, wash your hand. It's as simple. And if people cough persistently beside you, make sure you maintain a 1.2 meter distance.
He has never expressed any desire to leave the facility to the doctors.
It's a day after the federal government announced that Nigeria had joined the rank of countries affected by the outbreak of the deadly coronavirus. It's also the day residents of Lagos State woke up to news reports that the coronavirus patient currently in isolation in Yaba was upset with where he was being kept and threatened to escape. The reports caused a stir as everyone began to doubt the Lagos State government's readiness to combat the disease. This prompted the State Commissioner for Health, Professor Akin Abayomi, to speak with the media.
He arrived here on Thursday when we made the diagnosis. He's been on supportive treatment. He's actually doing very well. We were renovating part of the facility, so we kept him in a single isolation room for his privacy. But we've subsequently moved him to one of our completed wards, which is recently renovated with full complement of facilities. So he's right there now and he's comfortable. As of this morning, his condition has improved. He hasn't developed any new symptoms. But he's still got a mild fever, and we will be running tests to see what the situation is with the virus in his body. As soon as we get a negative screen, then as soon as we announced that Lagos was Ebola-free, we learned a huge amount of lessons from that experience. And the medical fraternity and the government don't want to experience what we experienced during the Ebola. So consistently, since 2014, we have been building capacity. You can see the level of sophistication in some of the facilities here, because we have been expecting something, whether it's a flu outbreak or a cholera outbreak or a Lassa outbreak or something unexpected like corona or even another Ebola outbreak. So we haven't been sitting down relaxing. We don't want to experience what happened in 2014 again. So we are ready, and we will continue to build that capacity year by year. We're designing new facilities for this place. This place is going to become a center of excellence for infectious diseases, and with a large capacity for isolating patients if we have a major outbreak. So it's a step-by-step process, but it's very advanced. The facilities here are world-class. We have a biosafety level 3. It's one of very few on the continent of Africa, and this is a very modern design, specially designed to handle dangerous pathogens, so that at least we can make the diagnosis on site. And the staff that work in there are specially trained. We've been training them for 2 years in collaboration with international partners. And the facility you see here was designed by international engineers. So we are ready for any biosecurity threat to Lagos State.
So far, the Commissioner for Health says the state is yet to put the number of contacts that have been identified because the figures are still being collated. Professor Abayomi urged residents not to panic and assured them that the state government was putting necessary measures in place to curb the spread of the coronavirus.
Lagos State government has said that it will not stop at nothing to give the best to stop the spread of coronavirus. We were at another briefing organized by the Lagos State government at the Infectious Disease Hospital in Yaba.
Lagos State government has spared no chance to update the world since deadly coronavirus found its way into Nigeria. This time, the venue is the infectious disease hospital in Yaba. This building behind me is where the first patient of coronavirus in Nigeria is currently receiving treatment. Here at the biosecurity unit of the infectious disease hospital in Yaba, health professionals here say he is responding to treatment, but many have criticized the Lagos State government for bringing in the index case to Lagos from Ogun State.
The patient started his journey in Lagos State, ended up in Ogun State. Lagos is the designated testing site for coronavirus, and Lagos has very sophisticated containment facilities, while other states are still trying to develop similar capacity. If we had left the patient in Ogun State, transmission is a factor of time. The longer you leave it, the more opportunity you have for transmission. So it was critical for us to collaborate with Ogun State to bring the patient to where we have the expertise to contain him, to make the correct diagnosis, and to deliver the correct treatment. And that is exactly what happened. Lagos State does not want an outbreak on its borders. So Lagos and Ogun State are actually one contiguous community. And if there was an opportunity for people to transmit the infection in a neighboring state like Ogun State, definitely Lagos would have become affected.
Now the governor and his deputy are not just seated here, but to get first-hand information.
We now feel that we have the situation under control, but you can never tell what's going to happen, and we must always be in a state of extreme readiness. And while we are sharpening up our skills and our networking and our preparedness, we must always be one step ahead of this virus, because it is a highly contagious virus and it spreads very quickly through community. That's the bad news. The good news is that its fatality rate is extremely low. What does that mean? It means that most people will recover, and only very few people will get extremely sick and may end up in hospital for a long time, and a fewer people may die. Some people may even get the infection and not know that they had it.
Governor Sanwo-Olu is happy at the level of preparedness of the state on COVID-19, appreciates health professionals who put their lives on the line to save others.
Ensure that we stop at nothing to give the very best at all times. Even externally, we can see that resources have been well put to good use, and I want to thank you on behalf of the other colleagues in Cabinet for doing a good job. Let me also use this opportunity on behalf of the government and the people of Lagos State, and by extension, all Nigerians, to thank each and every one of you on this table here this afternoon for risking your life, but more importantly, for writing your names because that's what is going to happen at the end of the day. To be part of history, because like I explained professionally, it's a virus that we haven't seen before, and it's something that all of us are learning as we go along. But all of you professionally have donated your time, your intellect, your skill to be part of this national assignment. We cannot but commend and thank you so very much for making this happen. Are available. We will make sure that we make this place as comfortable as humanly possible for all of you. It will be difficult, but we will ensure that the comfort that is required, just so that you don't burn up very easily and you don't get tired. That will make the place as comfortable as is expected. And if there are locations around that we can also prepare, so that your turnaround time will be faster and quicker. If you need to take a 1 hour or a 2 hour nap or something, we'll make sure that we look for locations around and you can go, have that, quiet time and come back, to this command. We will make all of that available. They need to be rest assured that the professionals, the people that have been trained to handle matters that they are on the ground to do it, and that we're doing everything to ensure that if anything happens, you've seen all sort of person-to-person and incident commanders and people that will go around ensuring that we can locate contact persons and we bring them, around, just so that we're sure that there are no eventualities around the state or the country.
For the government, all hands are on deck to tackle the coronavirus scourge head-on in the state.
Basic hygiene like washing of hands with soap and using alcoholic-based sanitizers can go a long way in reducing the transmission of this deadly disease called coronavirus. And that's a package this week. Many thanks for being a part of it. I'm Adedoja. Salam Adeni.